Good morning. I'm David Clooney, Executive Director of the Black Economic Alliance, and on behalf of the board and members of BEA, welcome to the next installment in our speaker series. Today, we're going to talk about the health and economic outcomes of the pandemic. We've heard a lot of talk about low-income communities, particularly communities of color, and particularly Black Americans, experiencing worse health and economic outcomes, and in particular, Black Americans contracting the virus and dying at higher rates and experiencing some of the worst economic outcomes. Today, we're going to dig a little deeper about how we got here, but also talk about what this means in the context of where our economic and healthcare trajectory was heading before the pandemic, and how the pandemic is changing what the road ahead does look like and could look like, depending on the action we take now. So on the economic side, we have Sarah Wartell, who after a distinguished career as a practicing attorney in government service in various roles at the U.S. Department of Housing and Urban Development, and then as Deputy Assistant to President Clinton for Economic Policy, and also as Executive Vice President and co-founder of the Center for American Progress, or CAP as we call it. Sarah became the third president of the Urban Institute in 2012. For those who don't know, the Urban Institute is an economic and social science research and policy organization that, among many other things, delivers insights from its research to federal, state, and local government practice and policymaking. And I'll say, BEA looks to Sarah and the Urban Institute for research, insights, thought leadership early and often. So you'll see us cite urban research and data frequently. On the health side, we have Dr. Zeke Emanuel, that's MD and PhD. Probably take me about 45 minutes just to read his current title, so I'll do my best to keep it very brief. At the University of Pennsylvania, Zeke serves as Vice Provost of Global Initiatives, Chair of the Department of Medical Ethics and Health Policy, co-director of the Healthcare Transformation Institute at the School of Medicine and the Wharton School, and as a professor. And in his spare time, currently serves as a senior fellow at the Center for American Progress. He's an op-ed contributor to the New York Times, regular guest on a number of news programs as an expert on public health. And I'll say relevant to this discussion, during the Obama administration, he served as special advisor for health policy to the director of the White House Office of Management and Budget. And he previously served on President Clinton's healthcare task force, among many other commissions and panels. Sarah and Zeke, thank you both for being with us today and lending your truly expert perspectives to this important discussion. With that, I'll turn the program over to BEA co-chairs, Dr. Tony Coles, medical doctor that is, and Charles Phillips. Tony and Charles, over to you.
Good, thank you, David. And Sarah and Zeke, let me add our thanks for your joining us today. It's really a pleasure. And I've been very excited about today's conversation for a number of reasons. In the spirit of full disclosure, Zeke and I have known each other for a very long time, since medical school days, and have exchanged lots of thoughts and ideas over the years. So Zeke, it's a pleasure to have you with us, sharing your expertise. And Sarah's been a wonderful friend and a wonderful friend of BEA for a long time. In fact, one of our first conversations about the economic policies affecting Black Americans was as a result of some work Sarah provided, which really helped shape the foundation. So I feel as though this is a conversation all in the family today. Zeke, let's if we can, let's start with the health consequences of the COVID pandemic. One of the things we know is that there's a long history of a higher proportion of comorbid conditions amongst Black Americans, diabetes, hypertension, and we know that this is a relevant factor for those who are infected. We also know that there is a long history of data supporting the disparities in access to healthcare and healthcare outcomes for Black Americans. And then finally, something you know a lot about, the Affordable Care Act passed almost a decade ago now, provided for the opportunity to expand Medicaid in all 50 states, yet in the states where the highest proportions of Black Americans live, many of those states have chosen not to expand Medicaid. Think about the consequence or the difference we might be living with today if those states had, and if we had been able to better address the comorbid conditions for Black Americans. 65% of Black Americans live in the upper Midwest, the Northeast, and the Southeast, and we know well that several of the Southeastern states have yet to expand Medicaid. So with that broad backdrop, there's ample reason to explain this, but from your perspective and from your perch, talk a little bit about why this is such an important issue and with such dire consequences in the Black community.
So I think what COVID has done for America generally and the Black community in particular has really exposed age-old problems and made them extremely stark in a very short amount of time and made it hard to ignore the consequences. Just to put it in, I live in Washington, D.C., as Sarah does, and in the district here, under 50%, slightly under 50% of the population is Black. 80% of the deaths from COVID-19 are among Black residents. And that gives you everything you need to know about the disparate impact of this illness and how it's ravaging much more the African-American community. And if you look in the city where there's just high proportions of patients, it's exactly the kind of locations where African-Americans live, whether Columbia Heights, Capitol Hill area. So that's the background. It is having this disproportionate impact. And then, as you point out, the question is why? And I think that there are four explanations, one of which you very, very clearly mentioned, and that is higher levels of the comorbid conditions that predispose to COVID, diabetes, hypertension, obesity, renal failure. But those didn't just come. I mean, they have a long history, and part of that history is one of economic and social deprivation. So, you know, one of the explanations, potential explanations for the disproportionate impact on COVID is the living conditions and the nutrition conditions in African-American communities. The more crowded housing, multi-generation families in very, very small areas. I think I noted in one of these interviews that, you know, the CDC recommends if someone in the family has COVID-19 that they should have a separate bedroom and a separate bathroom. Well, that's got to be the biggest joke possible for many, many Americans and a disproportionate number of African Americans because of the housing conditions that have a very, very long historical or reason, right, because of redlining and many other factors. So that's a second explanation, the sort of historical food and housing and other socioeconomic deprivations. I think a third one is the, you also mentioned, Tony, and we both experienced this sort of disproportionate access to healthcare services, physicians, et cetera. Some of that is insurance. And yes, the ACA was meant to address it, and it has. It's closed the gap on insurance between whites and African Americans. But as you point out, there are 14 states in the US which still haven't expanded Medicaid. We had intended that all would expand Medicaid. If they wouldn't get any Medicaid money, so it would be a very simple decision for them. It still is a simple decision. It's financially very advantageous for states, and yet there's ideology. Texas, Florida, Georgia, North Carolina are the big states that haven't expanded, and high proportion of African-American communities in those states that are being denied Medicaid, and a lot of, you know, able-bodied African-Americans who jobs pay too little to be eligible for either insurance through the job or the exchanges and can't get Medicaid. It's a terrible Medicaid gap that we need to close. And the last thing I would say is that we know historically there's a lot of distrust of the government and the medical community because of things that have been done to the African-American community. Tuskegee is only the most egregious example, but by no means the only one. And we have very good data that when people learned about Tuskegee in the African-American community, their use of services went down, their suspicion of the medical community went up, and it has caused disproportionate impact. All of these things, and we don't know what proportion is which explanation, have made it hard for African Americans to beat this illness and made them particularly vulnerable to getting it and to dying from it, unfortunately. And if we want to solve the problem, the really only way to solve the problem is to solve the underlying social and economic deprivations and healthcare disparities. I would say that if I had to say one positive thing, and I do think that there is a positive thing here, probably in the last 2 years before COVID, so we're talking about 2018, 2019, you know, one of the most important trends in healthcare was a real focus on the socioeconomic disparities, recognizing that if we could close them, we could do a amount to actually close the healthcare outcome disparity in the United States. And so among venture capitalists, the hottest, and among healthcare companies, the hottest area was getting companies that could help people address socioeconomic disparities. So I think for the first time, there was real recognition in the established medical community of the importance of socioeconomic disparities, and a real attempt to address it by, new startups, new ways of thinking about how to address these problems. Whether that'll continue through COVID and actually get more fuel through COVID, I think is the big question. And we simply don't know the answer to that at this point.
Well, let's see what Sarah might think, because I think you're right to point out that not just on a living conditions basis, many people in America have difficulty actually with the social distancing and the quarantining that we know is effective in controlling the spread of the disease. But this also spills over into the kind of the low wage paying service jobs that are designated as essential jobs. Many African Americans haven't had the luxury of social distancing at home and working from home or Zooming to do their ordinary means of income. And Sarah, we know that the Urban Institute has actually been monitoring a number of trends. You have your health reform monitoring survey, which you've adapted a little bit to better understand the impact of COVID. Talk a little bit about the bridge between Zach's wonderful description of the medical implications, and let's bridge that to the economic implications.
Sure, that's great. And thanks for having me on this important conversation. I think first, just to lift up something Zeke said, our history in society of discrimination is physically mapped in the way we live today. And the health consequences are thus being revealed in that same mapping. So we can almost viscerally see the way that discrimination, segregation has mapped itself out in where we're seeing these high point spikes in death. And Zeke talked about both the South and the big cities in the Northeast. We're seeing real hotspots of health effects like downtown DC, but certainly in the industrial areas in the Midwest, where these cities are just seeing just horrendous levels of Black both health consequences and especially death. So if you ever needed a moment when you wanted to see that our history of racial discrimination is with us today, you can see it in these patterns. The survey that you mentioned, thank you, was one that we had done to monitor the effects of healthcare reform. And it's an ongoing survey, but we sort of pivoted to really measure how COVID was affecting people. And interestingly enough, as you say, we saw that 4 out of 10 Black American adults lived in households where they were facing either job loss, loss of income because of COVID, furloughs, other economic consequences. And the result of that was a variety of hardships, food insecurity, anxiety, stress on family, et cetera. And all of that was measured. The thing that's interesting about that is that 4 and 10 number is just about average for the rest of the country, and is lower than that of Hispanic families for the most part, where they're seeing much more immediate job loss. And a lot of that has to do with our own history of occupational segregation, where Blacks are disproportionately in those essential jobs, the jobs where they are not able to protect themselves from health effects, and thus, again, another reason why we're seeing increased rates of infection. But at the same time, also, they are in the jobs that don't necessarily pay as well. And just to sort of help us look a little bit forward from this moment, if you think about what those jobs are, they tend to be not particularly well compensated. But we have found that service industry jobs have suddenly, just recently, begun to see rising wages, a kind of lag that we would have thought earlier in the economic cycle when growth was really starting. We were seeing a lot of expansion and we were seeing job creation, but we weren't seeing labor rate gains, the rate at which people were being compensated. We're finally starting to see that. And there's a couple of reasons for that. One, unfortunately, because of our nation's immigration policies that have slowed the growth of the labor force. Also because of changes in our own demographic patterns, and that also slow the rate of growth of the labor force. But it's also because so much economic growth created more and more demand. This crisis is almost certain to slow those effects in their tracks. And the result of that is that those who continue to have jobs may not see the wage gains that we were only just beginning to experience. Also, I think it's going to cause us to to explore how we use technology more. So whereas once we were looking at a decade in which we were likely to see sort of the future of work eliminating number of jobs and an urgent need for retraining, some of that decade's worth of job elimination may happen in 6 to 9 months. And then finally, I think some of the roles that many Black Americans play in society and service industry jobs are in-person services. And even after the healthcare crisis is entirely behind us, we suspect behavioral change will mean that there'll be more tendency to substitute for in-person services of different kinds. So we have to look at this immediate economic consequence, but we also really have to be thinking about, is this a moment in which we tackle some of those historical legacies so that the future we build back is one that doesn't have these consequences embedded in our structures?
That's a really important point, Sarah, because I feel a little bit as though we have one foot in the past dealing with some of these systemic inequalities that have been legislated even, and we've talked a lot about that here at BEA. We've got this particular moment, but we've got to pivot to the future, and there are some real vulnerabilities there. We want to come back to what the future may hold in terms of the rise in automation and what the crisis today may do in terms of accelerating some of that. So we'll come to that in just a moment. But Zeke, let's come back to you for just a second. You've been doing work at the Center for American Progress about how to end the coronavirus crisis. Obviously, from the individual economic impacts that Sarah is talking about to the broader economic opportunity and maintaining or neutralizing the impact on GDP, there's a whole conversation about how we get the economy going again and how we get America back to work. Talk a little bit about that conversation, which has, in a way, forced perhaps a set of false choices for us. But what's your perspective on, A, how we balance the broader economic pieces with the health pieces when testing's likely to be available, how we get the country moving again? And Sarah, we'll come back to you because your perspective here will also be important. Sure. But I think it's really, this is in the headlines every day. And I think we really should have a deep conversation about the broader implications.
Yeah, no, I think, look, everyone's for opening up the economy. I think the issue is the pace and the infrastructure with which you want to do it. And I think the idea that we should just open up without seeing declines in the rate of new infections, without seeing adequate testing, adequate contact tracing infrastructure, I think is what is at issue. So you see places like Georgia rushing ahead while their rate of new infections and death was going up. It makes no sense from an epidemiological standpoint. And actually, I just, right before our call here today, had a call from a New York Times reporter about, well, we haven't seen anything in Georgia over the last 2 weeks. And I was like, dude, that is like the wrong time period. You need to look at 6 to 10 weeks because the data we're seeing today is really reflecting pre-opening up. So you're not going to see the problems for 6 to 10 weeks, but then you're going to see us probably get on this exponential upward curve. So it's important to understand that the data we're looking at today is a lagging indicator. So what we at the Center for American Progress asked is, how can we open up? How do we go through the stages? And, I'm going to give the president a little credit. It's not the task force. Look, they made, I think, two important points.
We are a nonpartisan group, so it's actually okay.
And I think they've made... They've made two important things, and I've given credit to them in the New York Times. And first is, look, it's not going to be the flip of a light switch. It's phased. They've got 3 phases. Maybe that's the right number. Maybe it's not. But it's phased, and you can't progress to the end. The whole economy's open. Large gatherings are possible until you've gone through. The second is that different businesses will open at different times. You will not open large sports gatherings right away. And I would add a third thing, which they didn't say, but now it's becoming much, much clearer, Tony, and that is, look, the vast majority of the exchange of COVID here and how people get infected are closed spaces where you're with other people for a prolonged period of time. And especially if they're sneezing or coughing or singing going on. Just think of what those spaces are. They're closed work environments that are open, and the air handling can't handle all those people. We've seen a lot of infections that way. They're restaurants that are closed. They're housing units that are closed, and their transportation where you're all stuck in a car rebreathing more than 10 minutes with someone else. Those are places that it's going to be really hard to open them. Places that have more outdoor air, better air circulation, fewer people, or where the interaction is 10 minutes or less, those are places we're likely to open much faster. And that's how we have to think about it. We also need to begin doing a lot more testing. You know, they're talking about at the end, I think, of next month, having 40 million tests a month. 40 million tests a month is 1.3 million tests a day. Most experts think that's good, but hardly adequate. You know, I've suggested 2 million up to 5 million tests a day are what are really needed. And part of that reason is that about 44% of the COVID contamination is from people who are either asymptomatic or pre-symptomatic. They haven't got the symptoms yet, and yet they're infectious. And I think that's, you know, a very important group that we have to monitor and get to get to take better precautions. I think as we think about opening, those are going to be important. And one of the things, the last thing we did at CAP is try to suggest, you know, contact tracing can't be the old gumshoe contact tracing, everyone you remember for the last 5 days. It has to involve tech. And I have to say, I am somewhat critical of tech. I don't think they've been there in this. It's hard to think of anything they've done in the 2 months that we've really been focused on this to actually advance the contact tracing. And this Google, Apple, Bluetooth thing, I don't think is so novel, so advanced. And you look at countries that have done a much better job, whether it's Israel or South Korea or Taiwan, tech is a much more integral component of how they've been able to control this. And this should be something that could be a boon. And to sort of segue into Sarah's economic, look, contact tracing is going to require hundreds of thousands of people, whether students or people who have lost their job and we could retrain them. It's not a complex thing to do, but it does require training. And I think we need to get on the stick with that. And we need to have real government support and efforts around this. It's not going to ameliorate 36 million lost jobs, but it's one of the components that we can do that will have this dual benefit, employ people and combat the COVID crisis. And we have to think of a lot of those. Another one that I've been advocating and I think, you know, needs some attention is, you know, can we do this? Can we do this in the, you know, camps, summer camps for kids, which I think is very important. Sorry for that interruption.
No. That it's a rich bridge to the next set of conversations. So you're saying that this may not necessarily be a false choice. You're saying that there are probably ways to do this safely and get the country back to work. I'm going to reduce it to the 3 T's: testing, tracing, and technology. And I like that framework. It kind of works for the way that I think. But we're going to talk about technology in just a minute. But Sarah, is he right? Is this a false choice? Do we have to choose the economy or the public safety of Americans? What's your perspective?
I think Zeke's right that we need to pursue both simultaneously. That said, there are some real trade-offs. The longer the economy is closed, it's likely the case the economic impacts will be greater, and the economic impacts will be greater disproportionately for the people we're talking about here today, right? On the other hand, it is also the case that the health consequences are landing so disproportionately on Black Americans that there is something that is deeply morally upsetting about the ease with which some would like to open the country before we have the 3 T's in place. that worries me a little bit about how we think about our shared futures together. In some ways, this is a moment when we can see the ways we are all deeply connected and our fates are related. And it's, if I want to be optimistic, it is that the essential worker is getting our respect in a way that they have not before. And that we see that every American's well-being is directly related to every other American's well-being, and actually around the world. On the other hand, it is the case, just one example, Zeke talked about those closed spaces. Those closed spaces are the quintessential description of public transportation and who disproportionately uses public transportation to get to work. So you are saying to folks that the risk, if I were to return to my office, would be very different than for a frontline worker who has to get on the metro or a bus to get to a job on the other side of town, maybe with a longer commute than on average also. So I think it is about getting the infrastructure in place and being really mindful of the infrastructure that is protective for different types of people with different work experiences.
So can I pick up on something Sarah said, which I think has frustrated me since bailout bill #1, which is if you're a epidemiology medical type looking at this, you're like, it's 18 months minimum if everything goes perfectly and we get a vaccine. And yet the bailouts, even 1, 2, 3, 4, have all been relatively short term, right? We had the Payroll Preservation Act or whatever, and that was a few weeks. We have had an increase in unemployment, which very welcome, and an added $600, but short term, not to the end of this crisis. And it seems to me one of the things we need to do, and I know that the House is thinking about this, is much more structural change that really understands the magnitude of this problem. And so, and when I think about it is, look, we need to screw this healthcare problem and finally end the fact that we've got still 10% uninsured. We can get to universal coverage. It's not rocket science. It's probably not going to be through Medicare for all, but there's other approaches. Maybe it's Medicaid for anyone who doesn't have employer or Medicare. Maybe it's, an open exchange based upon Medicare. There are lots of ways I can think about doing it, but we have to solve that problem.
Well,
we also need.
Oh, I'm sorry. Go ahead. Please.
No. We also need to solve the problem, I think, that of unemployment insurance and sick leave and all of that. Only 40% of the workforce gets paid sick leave. I mean, it just makes no sense in the midst of a pandemic. It has to be universal, whether you're doing contract workers or you have to pay based upon your workforce, whatever you call them, whether you're calling them contractors or employees. And I think that has to change. And, similarly, I think we need to think about some debt relief at this moment. We've done a little bit about, trying to help on mortgages and, the big aspect of debt relief, and I think this can be a real transformation, is let's convert all those educational loans at one fell swoop to educational debt to loans that are forgivable in the following sense. You don't pay anything back, zero, until your income is above some very comfortable threshold, 70,000, 65,000, pick your number. So that if you're done education and your income is stuck at 50, you're not saddled with paying back a loan that you can't afford to pay back. And that makes it harder for you to actually live a middle-class life. We have to recognize you can start paying back when you have some spare cash, and that's probably around the 70,000 mark. And I think though that combination, and these aren't changes that are built for 3 weeks, they're structural changes. And I want to see us do more structural thinking. Now, I suspect, because Congress is controlled by McConnell, and now we're getting a very resistant Republican Party to even additional supports, despite the Fed and most economists saying we need additional supports. That's the problem. And so, we're not going to get this structural change thinking even until after the election. But it's pivotal to think about how do we take this moment, like the Great Depression, and really change what the government does in terms of providing a non-wholly safety net, one that doesn't allow lots of people to slide through. Sorry for interrupting you, Tony, on my rant.
So no, Zeke. This is and this is actually where we wanted to take the conversation next. So it's a great segue. I'm going to ask Charles. I'm going to turn over to Charles in just one second, but let me make just a couple of comments to what you just said. First of all, this crisis has been called the Great Equalizer, and we now, for reasons we've already talked about for the last 20 minutes, know that that's not necessarily the case. Sarah, you've done some work looking at the future for Black Americans in terms of economic opportunity, employment, et cetera, and we should get to that. So it really is still disproportionately affecting some. Charles, David, and I were on the phone with Leader Schumer just the other day around what's now becoming known as CARES 2.0, which is the next stimulus or recovery plan, which I think you'll be pleased to know, Zeke, will take a slightly longer lens, assuming we can move past some of the partisan conversations. Because part of what we've been focused on at BEA is ensuring that dollars get to minority communities and minority small businesses, but longer term, that impact can be sustained in many of the ways that you've talked about. But Charles, let me lateral to you, and then Sarah, we want to come back to you in just a moment to talk about what's likely to happen to the average Black American as a result of this crisis economically.
Hi, Zeke and Sarah.
Hi.
I want to start with more of a structural question on the economy, kind of where we're going to end up, say, a year from now. Let's assume the test is in place and we have tracing and the tech companies step up and all that. There's something about cities that relied on social density. A city like New York, that was the appeal of it, that you have a lot of people in one place. We go to restaurants, we go to plays. And so a year from now, if that's in place, do you foresee it being okay for people to re-densify, put it like that? And if not, that has implications for the types of jobs that are available. The service jobs that Black people are exposed to rely on that density as well. And so kind of what's the implication if we all decide to work at home for the next 50 years?
I don't think we're all going to decide to work at home for the next 50 years, and I don't think we're going to entirely reverse the pattern we've seen of reurbanization, but I think it's going to look different, and I do think there will be preferences for people that will be chosen over time, and some of those people will choose to live in less dense areas. And once again, I suspect, just as for a long time we worried our cities were disproportionately people of low income and that our suburbs were where people with income chose to go, and then you saw an inversion of that in recent years, particularly amongst younger families, I suspect you may start to see people who have been dealing with the struggles of their local school systems to educate their kids through this period, et cetera. We may start to see a kind of a softening again of the attraction of the center city. But I don't think the economic forces that we described and the quality of life forces that were drawing people to the city are going to go away. These are changes at the margin, provided that we're doing the smart stuff that Zeke talked about. This one thing for us to remember is the pace at which we have experienced crises in the last 20 years is so much greater. If you think about the crises from that are regional, not national, but that really are born of climate change. And if you think about the rate of technological innovation, and you think about, excuse me, the health pandemics, which we know we're more susceptible to, it is almost certain that we need to build a system and a structure that is resilient to a lot of different kinds of changes. That may mean a social safety net and a social contract that's designed very differently. That may mean different kinds of health infrastructure and access to services, including digitally. And we haven't talked about yet the power of the digital divide, which is one of the great barriers that some of us have been able to continue our work, and others, because their work is not online, have not. We're going to have to think about ways to increase the digital literacy and capacity of individuals so that they're not further excluded from the very places where jobs are likely to go. And if we can do that well, we can then make it safe to be in service-oriented industries that are geographically located, as long as we also have parks and recreation and a lot of other spaces that give people the outlets that also allow us to have our recreation in safer ways. So world is going to be, it's going to look different. I can't tell you exactly how it's going to look. Anyone who does, you should probably not invest because if they're certain, but I think it'll scramble itself in ways that will not be unidirectional.
Sarah, let's we've got one question that's been submitted from the audience, and we'll have you take this, and it will lead into that other conversation we wanted to have. The pandemic has eliminated many of the lower wage jobs and service jobs. According to a study I've seen for New England, 76% of people making less than $25,000 a year are at risk of losing their job, versus 2% of people making greater than $70,000 per year. This type of job loss for those with little wealth is devastating. What sort of policies would you recommend to assist this segment of the population in the short and longer terms? This bridges to some of Zeke's comments, but it also speaks to what's likely to happen as a result of automation.
Well, so in the very short term, I think we, as Zeke said, we need to think about the bridges. Because the consequences of this are not going to be a quick fee and we're back in 2 months. So for example, the UI is slated to end at the end of 6 months, the expanded UI. I'm a rental housing, a housing market expert, and we've been marching very closely and surprised at the rate which most people have managed to continue to pay their rent, but renters are disproportionately of color, renters are disproportionately people who are in the more vulnerable industries to the crisis. And when that expanded UI goes away, or people in the informal economy who aren't getting the expanded UI, people who are undocumented, et cetera, we're already seeing rent diminution, but we're going to see it big time at the end of that 6 months. And by the way, who owns the properties that those people pay rent to? Disproportionately African-American, interestingly. Small properties are very often owned. It's the form of wealth that we see for people who've acquired it in their neighborhood, is they may have rent coming in from 3 or 4 people in a small property. So we're going to have rental areas, just one of the places that if we don't support that, we're going to see a larger economic collapse, and that will affect credit and lending to these same populations over time. So we're going to have to find a way to continue to bridge in the short term. In the longer term, we want to replace income with work rather than with subsidy. And the question is going to be how we're going to do that. And there are a whole raft. In fact, we just put up a collection of different suggestions about different kinds of employment projects on our website. And let me just give a few ideas. Zeke talked about national service, and essentially a kind of national service or at least Job Corps related to contact tracing, and certainly we can do that. But there's a broader set of ways in which we can enlist people to solve some of our challenges and create steady work. We have a long history with government subsidized job programs, and we know that generally when they support jobs for nonprofits and government, they tend to disproportionately go to people of color. We also know that when we support jobs in the private sector through tax credits and others, we have risks of substitution, meaning that the government supports a job that would be there. But if they do, they tend to have more lasting effects on employment. So getting a mix of those kind and designing that well, we should be designing it now because we're going to need it in 6 months. And if we're thinking about the design of an employment program, one of the things that we should be thinking about is things like apprenticeships, where they have the best of those both worlds, where you actually have an employer that has a pathway to a longer term, better job. It has training, so it's in the private sector in many cases, not always, but it is the kind of job that is likely to have lasting effects, but where we can design and increasingly make sure that they are meeting the needs of the populations. We also ought to be thinking about employment and reentry, a special targeted group that helps us to avoid social costs. If we're bringing people out of concentrated areas for health reasons in prisons, that would be another really important place to be targeting our resources for encouraging work, and to make sure that there's a host of supports around that work so that those are jobs that people can keep over time. We could talk about this a lot more, but just some examples.
Can I add one other thing, Sarah, which
Sure.
is it's even longer term than what you're talking about, and I think you're talking about serious structural change that we really need to do, and it's very targeted. But you know, the best investment from a return standpoint and from a business standpoint that the government can make is early childhood interventions. And one of the things that I've long been an advocate of, and it gives returns, we now have data 30, 40 years down the line, but the returns are huge. They're like between $7 and $15 for every dollar invested, and they begin to show up much faster. They begin to show up within 3 to 5 years. But those early childhood interventions, and one of the ideas I think we really need to do is to link them to any any kid born on Medicaid, which is now between 40 and 50% of children, depending upon the state, gets early childhood interventions for the first 2 years. Great way of, again, putting people to work, and a great way of reassuring mothers, educating parents about how to raise kids. But the long-term consequences, mainly in social interactions and social knowledge and emotional understanding, is huge and long-lasting. And I think that's, that is very long-term, but it's the kind of thing that we can do that can really make a structural change for the long haul, and for children. It has ramifications for the criminal justice system, the healthcare system, and the educational system, and frankly, for those kids' long-term economic earnings. Anyway, I think that's something that needs to be added to the mix.
Okay.
And if
Sarah?
I could just add super quick,
Sure.
a huge priority needs to be to disaggregate the data, not only on the describing the problems, but on where our existing programs are reaching. And the just appalling decision to have the SBA not require that race and ethnicity data be collected in PPP. We're trying to figure out how we can impute it and recreate it in other means. If you're going to design programs that meet the places where the need is greatest, you need to be able to both measure where that need is and how effectively your programs are. And this needs to be a huge push and a role for universities and places like us and profits, if the public sector is not doing it, to be able to describe much more granularly health, economic, and all these other impacts.
Charles?
So Sarah, one concern is just the transition over the next couple of years. I mean, there's a lot of great ideas around job subsidies or EITC, putting people back to work, which is what we want. But with 36 million people out of work, it's probably going to take some time. There'll be companies who will use this as an opportunity to kind of permanently get more efficient, let's say. And so what do you do for that group of people where maybe it's retail and hospitality workers, going to take quite a while? And there are there's 87 means tested programs today at federal government level. Does it make sense to turn some of those into actual cash assistance? Maybe not a universal basic income forever, but lots of research that shows giving people cash has a lot more impact in a lot of these programs and a lot more measurable. And so is this a time to kind of rethink a lot of those means tested programs?
Well, so a couple thoughts. First of all, that is in essence what the $1,200 immediate direct payment was. It was not targeted to people with loss, and our politics make these kind of direct cash assistance programs very challenging to do. We've been going in the other direction with imposing restrictions and cycling people in and out of programs, work requirements, et cetera, that tend to be mostly filters and not effective at encouraging and creating incentives to work. So clearly, the direction has to be in this bridge period, that kind of support. And there are some really interesting private sector models that we're seeing, or nonprofit models. In Ward 8 of DC, there are 6 nonprofits that have come together that is creating essentially a basic income pilot. You see Andrew Yang's been raising money around a number of them. There were some out on the West Coast already, even before the crisis. And a number of those are going to try to create a real evidence base that you can scale and grow. If we could get our public policy to support bridge income for people through this crisis, I suspect we would see, in the long term, unproven but likely savings to public sector costs, because otherwise we may just see a lost generation. But our challenge is to be able to do that, to be at all cost effective, is to be able to target that to the places where the need is greatest. And that's our political dilemma in the current environment, certainly.
So we are nearly out of time, unfortunately, and there's David right on cue. We're going to do a really, really quick kind of 15, 20-second lightning round. And the question is, what's ahead of us in the next 3 to 6 months that we aren't thinking about or talking about right now? And Zeke, we'll start with you.
Well, I don't know that we're not thinking about it, but we're certainly not prepared for it. And that's wave 2 of this virus, whether it occurs in July, August, or October, November. And most people think, well, it can't be as bad as it has been. And that's wrong. Just remind you that in the 1918-1919 pandemic, wave 2 was the really bad one, and wave 4 was worse than wave 3. And I do think that what Dr. Bright said yesterday in front of Congress about he's really worried about the fall and winter, we're not prepared for that.
Most people don't realize that Spanish flu lasted 2 years, from 1918 to 1920. And so,
I don't want to say anything about my mentor and recorrect, but you can actually see the effects on the mortality rate all the way through 2024. You're right. It did last 2 years in terms of waves of flu, but the impact on mortality actually is greater mortality for almost 5 years.
well,
So yes, it's a serious problem.
I've always known you were smarter than me, Zeke. So let's
False modesty, Tony Coles. False modesty.
Sarah, let's go to you. Lightning round. Quick round.
I'm afraid of a kind of social division and recrimination because this crisis, horrible as it is to imagine, will have some economic winners as well as economic losers. And there are certainly, as we've seen with the PPP program, there are people who have been able to benefit from the program and others who haven't. And we're about to go into a very heated election season at a time of intense partisanship. And I was initially hopeful at the shared experience that so many Americans were having, that there would be a greater sense of the common good. And I am encouraged by the way the business community is coming to understand their dependence on a healthy, vibrant middle class, on shrinking inequality. But the question will be then, will the actions follow in some of the ways we've been all talking about, turning to public purposes in the use of resources of private firms? And if we don't, I think the social unrest that we could see could mirror nothing we've seen since perhaps the Civil War. That's my fear. I hope I'm wrong.
We hope you're wrong too, but unfortunately, this may be the great unequalizer, as it turns out. So, Sarah, Zeke, you guys have been amazing. I've been stimulated by the conversation and the dialogue. Thank you guys again for joining us. David, we'll turn it back to you.
Thank you, Tony, and Sarah and Zeke. Once again, thank you so much for being with us today. Really important conversation, and we'll continue to look for both of your insights as we continue to work on this. Charles and Tony, great job as usual, walking us through it. And I'll just say as a programming note, the next in the speaker series will be next Tuesday, May 19th at 1:15 p.m. Eastern Daylight Time. That will be Fair Fight founder Stacey Abrams and Director, Counsel, and President of the NAACP Legal Defense and Educational Fund, Sherilyn Eiffel, talking about voter suppression. So very relevant to this conversation about the upcoming election and how all of these things will play out as a matter of public policy. So really looking forward to the next conversation. Thank you again, everybody, today for joining, and we will let you go. Thanks very much. Stay safe.
Thank you.
Thank you, guys.
Thank you.
Take care. Thanks.
I think we're done.